All right, it looks like we are reaching a critical mass of participants here. Good morning, everyone. Thank you for being with us today for this presentation on Pulse and a deep dive on healthcare findings. For those of you I don't know, I'm Alexis Waitman. I'm the Senior Government Affairs Manager here at the Colorado Health Foundation, and really happy to have you here today for this conversation. Just wanted to share a couple programming notes before we dive into the data. This session is being recorded, and we will share that recording afterwards, as well as all of the slides and materials from the conversation. You can find that at the Pulse website at copulse.org. Closed captioning is available through the control bar at the bottom of your Zoom screen. If anything is glitchy on your end, please drop a note in the chat, and we will do our best to address that. Speaking of the chat, we really hope that you will engage with us through the chat function. We want today to feel like a conversation, so please share your thoughts and questions as we go along. We'll also carve out dedicated time for Q&A at the end of the session. So just a little bit about the Colorado Health Foundation and the Pulse Poll before we begin. For those of you who are not familiar with us, the Colorado Health Foundation is a statewide, nonprofit, nonpartisan philanthropic organization that is focused on the health and well-being of every Coloradan. And we do this work by investing in and advocating for solutions that advance health equity. I will say the foundation is nonpartisan. We neither endorse ballot measures or candidates. We do not engage in lobbying activity, but we do seek to inform policy conversations and community conversations with relevant nonpartisan research, analysis, and community context. We really believe that health should be in good reach for everyone, and Pulse is one of our signature tools that helps us understand the perspectives of Coloradans around the state to make sure that we're getting that work right. A little bit about the Pulse poll itself. We launched this poll back in 2020 to get a read on how Coloradans are experiencing and feeling about the things that affect their everyday health and well-being. It is not a single issue poll survey. We do cover a lot of ground on a variety of topics that have implications for health broadly. But today we're spending time zeroing in specifically on what Coloradans told us about healthcare. And part of the power of Pulse is that we now have 7 years of data, and we can look longitudinally and really understand how those experiences and perspectives are changing over time. Everything we hear in the survey goes towards informing our work at the foundation. We also share this information very widely with policymakers, community leaders, media, and anyone who wants to engage with us in a conversation. In the spirit of transparency, all of the data is posted publicly at copulse.org, including an interactive dashboard that you can really dig in and explore the data yourself. One thing on our methodology, I will say we intentionally oversample certain segments of the population that are often left out of this type of survey. We do oversample Black Coloradans, Asian American and Pacific Islander communities, as well as Native Americans in Colorado, so that we can really have a clear perspective of how those experiences are showing up. Final note, and then we'll get to the data. I also wanted to mention that on September 24th, we are hosting a follow-up briefing that is focused specifically on findings among Hispanic and Latino Coloradans. That session will be conducted in Spanish with live English interpretation. So we hope you can share that opportunity with your networks and engage in that conversation as well. So with that, I'm happy to pass things over to one half of our bipartisan research team to walk us through the findings. I'd like to introduce you to Lucia. Thank you.
Thank you so much, Alexis. Hello, everyone. It's a pleasure to be here today. So I'm going to walk through some of the key findings of the research we did, specifically on kind of the healthcare segment of the poll. As Alexis mentioned, this is a wide-ranging survey, and this section really focuses deep dive on the healthcare questions we asked. Before I do that, just a quick introduction. So I'm Lucia Del Pupo. I'm a senior vice president at FM3. This is a collaboration done with New Bridge Strategy. When we work on partisan issues, our firm works on Democratic issues and their firm works on Republican issues, but we work on a whole series of bipartisan and nonpartisan issues together to bring in kind of those different perspectives. And so In terms of this survey, so we have had the pleasure of working with the foundation on the Pulse poll since 2020. So we have a wealth of kind of tracking data and comparison over time. At the same time, a lot of the questions we asked on healthcare this year were new, and that was very exciting to kind of dive a little bit deeper and look at it in different ways. This was a survey of adult Coloradans, so adults, Coloradans over 18. And we spoke to over 2,000 Coloradans. And as Alexis noted, we had some oversamples of Black and African American Coloradans, Native American Indigenous Coloradans, Asian American Coloradans, as well as residents of Morgan County. When looking at the data, the margin of error on this is about 3.2%. So it's just helpful to kind of keep in mind. And the survey was administered in English and Spanish, and folks were invited to participate in the online or phone survey via phone calls, email invitations, text invitations, and postcards with a QR code and a link. So kind of expansive outreach, but the end result is a survey that is representative of the Colorado population. So again, I touched on this on our contact methods. So we had a wide-ranging kind of inclusive ways of reaching out to folks to kind of reach people where they're at based on their preferences. And then as you can see here, regionally, we subdivided the state and look at some of the regional variations in the data. So you can get a sense of here of how we broke out the state in 5 different ways. And the percentages are basically based on the percentage of the population living in of the state living in those areas. So one of the questions we ask in the survey that we tend to ask pretty much every year is about some of the biggest problems facing Colorado. And we ask folks if each of these is an extremely serious, very serious, or somewhat serious problem. I think what really stood out to us this year throughout the poll, not just in the healthcare section, was the extent to which the cost of living is really weighing on folks and affecting a lot of their choices. And we do see that majorities are telling us that the cost of living and cost of housing and cost of healthcare are extremely serious problems, with more than 4 in 5 saying these are either extremely or very serious problems. So we'll dive a little bit more into this, but again, I think, really folks are feeling a lot of pressure. We saw some people, we had 3/4 of folks telling us they were worried about affording to live in Colorado in the future, and a lot of people making a lot of financial sacrifices to afford life here in Colorado. In terms of homelessness, that was also a top issue and obviously is closely intertwined with affordability, with 3/4 telling us it's an extremely or very serious problem. Other major problems, which roughly 2/3 said were very serious, were wildfires, jobs. Majority said the cost of childcare, although we had more folks who said that they didn't know or didn't have an opinion on that one. 57% pointed to mental health as a very serious problem, and majority said climate change, as well as 54% who said drug overdoses were extremely or very serious problem. And then violence and misconduct from federal immigration officials, a majority felt like that was a very serious problem. And as we continue down the list, we also saw illegal immigration. About half said that was a very serious problem. So and mistreatment of immigrants. And so all of those tend to be a little bit more ideological, depending on how folks kind of view the world. And so that created some splits there, why that's right around 50%. But we did see about half saying drugs and alcohol abuse were a very serious problem. And then similarly, about 2 in 5 said crime was a very serious problem. Strikingly, folks are more than twice as likely to say crime in general is very serious relative to crime in their neighborhoods. And then about 1/3 to 2 in 5 saying gun violence, racial bias and discrimination, restrictions on reproductive rights, and police violence and misconduct were very serious problems. If we compare these trends over time, you can see on the right in blue, there's a difference between what folks told us last year and this year. And what's striking is cost of healthcare has gone up 7 points as a concern relative to 2025 when it was 75%. Now it's 82%. But I think what really jumped out at us and our team was if we looked at back to 2021, it was 65%. So it's gone up steadily every year. 23, 24, it stayed pretty steady, but it's steadily increased. And in the past couple of years, really been a big uptick. So it's very much on top of mind for folks. And again, in general, cost of living is a big issue, but that has steadily increased over time. Mental health, in contrast, has remained relatively stable. It kind of peaked and was at its worst in 2023, but has remained more stable in the past 2, 3 years. So, in accordance with that, when we asked people if they felt like the cost of healthcare for their family had increased in the past year, decreased, or stayed about the same, we saw that nearly 2/3 said the costs had increased. Um, if we look to the right there, you can see some of the demographic groups who told us who were most likely to feel like their costs had increased. These included people who had purchased their own insurance, Democrats ages 50 and over. Interestingly, it was kind of a more Democratic profile, so there may have been some kind of also uh, ideological lens too, but also we see, retired folks, men 50 and over, those in Denver, people who are caregivers. So there's a lot of feeling there that costs have gone up. And I will say we did also ask a question about the afford or worry about being without insurance coverage. And what we saw was that 2 and 5 told us that they worried about being without insurance coverage in the coming year. And this is something that has steadily increased since we first started asking it in 2020. It was in the mid-20s, and now we're in the low 40s in terms of concern about being without insurance coverage. And that tends to be um, I shared across the board, but a little bit more intense, I think, for people who are on Medicaid. And when we ask people about financial sacrifices and affordability, we asked about a lot of different ones, but I think these ones really narrow in on some of the things most related to personal health. And what we saw was that this has kind of ping-ponged around, and we do see roughly about 2 and 5 over time. It's gone up, it's gone down a little bit over time, but 38% have told us that they were postponing dental care, and similar with medical care, it's sort of bounced up and down a little bit, but stayed in a similar range over the years. I think what is important is to look at the combination, and what we saw was that essentially nearly half of Coloradans said that they either postponed medical care or dental care in the past year. We also saw, the dark line, the darkest one there is the people who skipped meals because they couldn't afford food. That was at 17% this year. We saw layoffs stay pretty steady, but overall, I think this continual postponement of essential care for and affordability playing a role in that. We did ask people about how easy or difficult it was to get care for their physical health in the community. So we kind of treated mental health a little bit separate and had a separate set of questions on that. But in general, for physical health, we did see that 2/3 said it was easy. And this was pretty widely shared. It was interesting across regions and demographic groups. One group that did tend to say that it was not easy or was more likely to say it was difficult was the folks who are uninsured. We also asked people about their satisfaction with some different elements of healthcare services. And it was really striking, actually, that even though cost is such a big concern, there was part of us that thought maybe there would be more concern about other elements, but in fact, there was actually a lot of satisfaction. More than 3/4 were satisfied with how far they have to travel to see their healthcare provider. 3/4 said they were satisfied with the quality of care they received. 74% were satisfied with the attitude of healthcare providers and other medical staff towards their family. And then 64% were satisfied with the ability to see healthcare providers whenever needed. 50% said that the amount of time they wait to see a healthcare provider when they need an appointment, they were satisfied with that. Although it is notable, right, that it's 50% and 47% dissatisfied and only 18% very satisfied. So we're already seeing this on this issue a little bit more dissatisfaction, a little bit more concern. And then when it comes to out-of-pocket costs of healthcare, we do see that 60% are dissatisfied. It was interesting to see that the folks who were on Medicare were more likely to be satisfied. I believe 3 and 5 were satisfied with their out-of-pocket costs. Those on Medicaid were around 42%, and then everyone else was kind of in the mid 20s to high 30s in terms of satisfaction. So definitely if folks are on Medicare, there's more satisfaction with their out-of-pocket costs versus most other folks. And again, a lot of this experience cuts across income and demographic groups, these concerns about their costs for healthcare. We did also look at some of these items by both urbanicity and region, and it was encouraging to see that how far they have to travel to see a healthcare provider was uniformly satisfying. People, there's some variation with slightly lower in rural, but it's still 71% satisfied, so quite high. And again, I think high satisfaction on a lot of these metrics. We did see that those in suburban areas were a little bit more satisfied with their wait times, but feelings towards costs were pretty negative across the state. And regionally, we did see some other variations. It was interesting to see that folks who live in the Eastern Plains were a little bit less likely to be satisfied about how far they have to travel to see a healthcare provider. Although they, in the previous question on the on being able to see to get physical health care easily, they were similar to other regions. But there is something about travel for the Eastern Plains folks that it's just a little bit more challenging there, a little bit less satisfaction. It's still majority satisfied, but different than some of the other areas of the state. We also see costs. They're a little bit more satisfied than other parts of the state. Some of that may have to do with some of the underlying demographics. As we noted earlier, if they're, more likely to be on Medicare, then it's more likely to be satisfied. So there could be some kind of underlying demographic factors as well that drive some of the differences that you see on the satisfaction on out-of-pocket costs. And then, sorry, I sort of spoke to this earlier, but just kind of highlighting again about how worried someone is about being without health insurance coverage. So earlier we saw, right, that 65% told us that costs had increased in the past year. We have 42% who are saying they're worried about being without health insurance coverage, and 56% who are not worried. If you compare that back to when we first started doing this poll in 2020, at that time it was 27% worried and 71% not worried. Additionally, the proportion who are very worried, that dark red bar, has nearly doubled. So there is a lot of concern about kind of the stability of access to health insurance coverage in the coming years. We did, as I noted earlier, ask some questions about mental health strain, and we saw that 3 in 5 told us that they had experienced mental health strain in the past year. This has been very stable over time, and since we started asking it in 2023. When we did look at who was most likely to have had these experiences, we saw that it was, interestingly, those who were not registered to vote, but we have people who were either on their parents' insurance, women under 50, renters, LGBTQ, under 30. So it does tend to be a little bit of a younger profile, but we also see, folks with young children, folks who have Health First Colorado insurance. So a lot, also some folks who are maybe more likely to experience financial strain. And we did see that, in fact, but financial strain was one of the elements that drove concern for, or drove mental health strain. We took a look at some of that we cross-tabbed, those who postpone versus those care versus those who experience mental health strain. And we did see that majorities of those who are experiencing mental health strain were postponing dental care, medical care, and they were more likely to postpone mental health care. So less access to health care, probably not, there might be kind of a back and forth effect there too with the experiences of mental health strain. And as I noted above earlier, we did ask folks who told us they were experiencing mental health strain what was driving that most for them. And at the very top were political issues and financial issues. It was very interesting to see that there was a bit of a age dynamic with kind of older adults more likely to point to political issues, and maybe adults on the younger side more likely to point to financial issues. But roughly a quarter of respondents each said those were their biggest source of mental health strain. About 14% mentioned family or relationship issues. 1 in 10 mentioned loans and payments and debts. 7% mentioned workplace, and 2% said something, related to their identity and fair treatment. We did see that more than 1/3 mentioned some sort of a financial issue, whether it was financial issues broadly or loan payments and debts specifically. So again, it's having a really big impact on people's mental health. So I'll pause there and pass it to Joanne.
Great. Thank you, Lucia. It's such a valuable picture of where Coloradans stand on healthcare right now. I'm Joanne Schwartz, and my team is proud to have supported CHF's Pulse Poll since its inception. And to help make sense of all of these findings and what they actually mean on the ground, I'm excited to welcome Ross Brooks, who's the CEO of the Colorado Community Health Network. CCHN represents Colorado's network of community health centers, so he brings a frontline perspective on a lot of what we just heard from Lucia. Ross also participates on the Colorado Health Foundation board. I'm going to facilitate a conversation with Ross to hear a bit more about his experience, and then we will also be able to bring some of our other guests back on camera to answer any other questions that you put in chat. So please don't hesitate to add more of those questions there. Ross, welcome. Thanks for joining us.
Thank you, Joanne. Great to see you. Thanks for having me.
Thank you. I'll start with the first question. We've heard you say before that when people lose affordable coverage, they don't stop needing care. They just stop getting care in the same way. Can you say more about what that shift in how people are getting care looks like for the patients in your network?
Thanks. Thanks for the invitation for the conversation today. And I want to start by celebrating National Health Center Week. So that's a celebration across the nation of our community health centers. Here in the state of Colorado, the community health centers have more than 250 sites across the state providing access to affordable primary, medical, dental, and behavioral health care statewide to more than 850,000 Coloradans. And the majority of our patients are lower income patients. So the data that we just looked at and have heard from the Pulse is very impactful and reflective of what our patients in the community health centers across the state experience. What we've seen is really a deterioration of health insurance coverage statewide over the last 3 to 4 years. That started first and foremost with the Medicaid public health emergency unwind, where we saw more than 500,000 Coloradans lose their Medicaid coverage. And while that has stabilized a little bit over the last year in the state of Colorado, we have at the beginning of this year, enhanced premium tax credits ended at the federal level as well, driving up premium rates for commercially insured individuals. And we have the looming HR1 on the horizon starting in 2027, which means more Medicaid covered individuals are going to lose their health insurance as well. That cloud means that hundreds of thousands of Coloradans have lost their affordable health coverage. And we see a lot of those patients in our community health centers. I think what that means practically for Coloradans, and we might think about this in our own families as well. If you think about a time that you were uninsured or underinsured, or perhaps had a family member who was uninsured or underinsured, or not even really sure whether they were going to qualify for commercial health insurance, I think we all become price sensitive. And healthcare is not exempt from that. And this data shows that more than, I think it was close to 80% of us or 78% of us are worried about the cost of healthcare. And what happens is when we don't have affordable coverage, we think twice about getting the preventative care that we might need. We think twice about getting the surgery we might need. We think twice about going to the dentist because I wonder, can I really afford that? Can my family afford that? How am I going to balance my checkbook with my housing needs, with my transportation needs, et cetera, et cetera? So unfortunately, this data rings true with what we see in the community health centers, and our patients are forced to make hard choices a lot of times in terms of what they can afford to access and what they have to put off for another day.
Thank you. That's really helpful to hear. Next question for you. As we think about the Colorado Health Foundation's Pulse Poll numbers, which cover everyone across the state, How do those numbers play out across your network? Does the data track with what your health centers are telling you? Does it look different in the patients that your health centers are serving?
The Health Foundation Pulse poll is indicative of what we see in the community health centers. Unfortunately, it's probably worse at the community health centers and in the low income populations that we serve across the state. And the reason in the real data that we see is the growth of the uninsured and those without health insurance coverage has grown dramatically faster than what we even see statewide average wise. So the percentage of folks that have lost Medicaid and the percentage of folks that have become newly uninsured has grown pretty dramatically. I think the other part in that is we've seen a little bit of growth in commercial health insurance, but I will say that sometimes that's underinsured commercial health insurance with high deductibles. And so folks, again, are price sensitive. If I have a really high deductible, I'm going to think twice about getting the preventative care I need and sometimes the specialty care that I might really need based on that. So we're unfortunately kind of the canary in the coal mine a lot of times, the community health centers or safety net clinics or other advanced primary care clinics that are treating people in the local community. We're seeing more and more of our patients lose their affordable health insurance coverage. I think practically what that means is, and I'll go back to the original comment, is folks will sometimes delay their care, their needed care. When I don't have health insurance or if I am underinsured, I think twice about getting the care that I need. And what we see in our patients is that often means people have delayed the necessary preventative care that they might need. And so chronic diseases and other conditions can become exacerbated without getting that upfront primary preventative care.
Thank you. And thanks for the great work that you and your network are doing. Just to expand on that answer, what does that mean when it comes to the providers in your network? So as they're having to deal with more folks who are coming later when something is much more acute, what does that mean for your providers?
That's a great question. And I think one of the beautiful parts of primary care providers, advanced primary care networks, community health centers, other safety net providers, mental health providers is that we don't treat people based on their insurance status. We treat the human being and the family agnostic to their coverage. Now, that does not mean that we don't have different issues and comorbidities and chronic disease management status. So, what that oftentimes means in the real world is that an uninsured individual who has put off their care, let's use a diabetic patient, for example. If I put off getting my insulin and helping manage my diabetes, oftentimes, worst case scenario, that can lead to diabetic ketoacidosis or foot amputations, a worst case scenario to death. So we see that in the real world every day when patients aren't able to get the preventative care they need. Sometimes health outcomes can be considerably worse, worst case scenario in terms of death. That's true in the mental health space as well. That's true in the oral health space as well, that patients will put off their care. Now, that is not universally true, and I really do want to come back to the point of advanced primary care providers and primary care practices take care of everyone, regardless of ability to pay. And but the health outcomes are worse for folks over the long run when we don't get the prevention that we need.
Thank you. And that was a good example that you just gave about a diabetic person who might be waiting too long to come in. Are there any other stories that can help illustrate for folks kind of the experiences that your providers and your network is feeling at the moment?
I think that let's go back to the diabetes example because it's really practical for lots of us. Like the cost of insulin, if I am insured or I'm uninsured, can sometimes be 10 times more for an uninsured patient. We work really hard to provide affordable medications to folks in need, and we have a great federal program called the 340B program that provides deeply discounted insulin to our patients or other needed medications to our patients. However, that price differential can be massively different based on my insurance status. And so a diabetic patient that is unable to access affordable insulin oftentimes might put off that care and that needed medication, and so their health outcomes will be worse. Another example might be delivery. delivery of a child, something that many of our families experience. I had the good fortune of leading a health center out in Western Colorado, and it was not an uncommon experience that our patients would have vastly different bills for their deliveries of their children based on their insurance status. That's an area where we're all price sensitive. And we would have sometimes would have a patient that would have a complicated C-section and was uninsured and could have a bill in the high five figures, low six figures for the delivery of their child, while as an insured patient might have a $5,000 bill. So you compare a $100,000 bill to a $5,000 bill based on insurance status. That has a major economic impact on a family based solely on their insurance status and what they're paying for delivering a child in the community. So those are two real life examples of what I think Coloradans experience and why the worries are increasing about what healthcare costs. And Joanne, I think you're muted.
Thank you. Thank you. Those examples are really helpful to really get a better picture of what you're experiencing in the field. Next question for you is as related to expanding coverage. And you've called protecting and expanding coverage like Medicaid one of the most effective investments Colorado can make. Can you walk us through that, the payoff, the cost in not making that investment?
Yeah, the return on investment in Medicaid coverage or health insurance coverage for folks is really well documented across many different states, including in our state in Colorado. And I know the Colorado Health Foundation has some really good data on the return on economic vitality and the return on individual outcomes by having coverage versus not having coverage. I think really just practically, we know that when folks don't have health insurance, they're more likely to die earlier. And that's the practical, really unfortunate outcome for Coloradans or people across the United States that health insurance coverage, while not the Pantheon solution, is a really important predictor of my ability to access care and affordable care when I'm covered or not covered. So I'm of the belief that we want to get as many Coloradans, ideally every Coloradan, covered by affordable health insurance coverage so that we can then get access to affordable health care across the community. So lots of other good data around that, around the value of health insurance coverage, the value of Medicaid coverage for folks in need, especially low income populations or those with complex comorbidities. And the outcomes are stark. It really comes down to my ability to live a happy, healthy, vibrant life or worry about the cost of my healthcare.
And final question for you, and then we're going to open it up to a broader Q&A. So folks, please feel free to jump in with any questions in the chat. We have an amazing group of folks who are listening in to this briefing today. If there's anything you'd want policymakers or this audience to take away from this conversation and your own experience, what would it be?
I think health insurance coverage matters. It matters for our families. If you think about what I want for my family, for my parents, for my children, and what we all want for our neighbors, we want to be covered. We want to have that peace of mind to know that we can access the care we need in our local community at affordable price. Coverage alone is not the Pantheon solution. I will say that again, but it's a really important base core foundational piece of me being able to access affordable care in my local community. So I think my encouragement for us as a state, for all the partners on the phone, is to work towards affordable coverage for all in the state of Colorado, across the state in our rural, urban, frontier communities, across the political divide. I think we want that for every single Coloradan to have access to affordable care and to have access to, to have access to affordable coverage and then access to the affordable care they need.
Thank you. Thanks again for joining us. I'm going to invite Lucia and Alexis to come back on camera as well. Great. We have a couple of questions in the chat. First, we'll start with a question related to childcare in the chat from Will. I think, Lucia, this is a question to you just about like how far back does our data go? What can it show?
Yeah, we haven't asked this question before. We had asked back in 2020 about kind of experiences of accessing childcare, but I don't think, and we'd asked in certain times, like how much it would help to have access to childcare, but the cost of childcare in this way is a serious problem. This was the first year that we put it in the poll like that. I will say what's worth noting is that when we look at parents of young children, that number goes up, right? So it was in the mid 50s for the whole population. But for parents of children under 6, it's 86% extremely or very serious as a problem. And for ages 6 to 12, it's 75%. So obviously the people for whom childcare is most expensive, it makes sense. They're dealing with their day-to-day. There was a question about whether it's increasing. I don't have, again, because we haven't exactly tracked it. I've seen some data in recent years from other surveys that had it in a similar ballpark. That said, the cost of living has been really high for the past couple of years. So presumably, if we had asked it 5, 10 years ago, it wouldn't have been quite as high. I think it's something that has continued to rise over time with the overall cost of living, but it's definitely something that's impacting a specific portion of the population. And I think that they're just, we do a lot of work on childcare nationally. And I will say in our experience, it is something that folks around the country are becoming more aware of and becoming aware of the importance of investing in early childhood, the benefits that it gives both to the economy and to children's growth, and the growing awareness of the need for funding is definitely something, a trend that we've noticed throughout the country.
Thanks, Lucia. We have 2 questions in the chat related to data that is not fully captured in Pulse. So I'll raise these questions, but we might just provide some recommendations about where this information is available. First question relates to the average yearly costs for healthcare and how that relates to unexpected expenses and how many folks could actually be able to afford a really high medical bill, healthcare bill. And then another question about the added cost when the first line is EMT and emergency services versus Ross, as you were talking about those preventative services. I don't know if we can point folks to other resources, Ross or Alexis, if you happen to have reference outside of Pulse that you want to mention.
I don't have good insight into that data. I think it's a great question. There might be one that we need to follow up on with additional data and feedback.
We'll look into that and see if we can follow up in our follow-up email. I also want to, we'll also just note like the concerns about the level of these costs, as Lucia also mentioned, and increasing costs of living overall. Those concerns rose tremendously through the pandemic, have stayed really high. And there's nothing indicating that those concerns are dropping anytime soon. So we know from Pulse just the level of concern and stress that that's creating for folks is definitely there. I do have a couple of additional questions. Alexis, first to you. From the Colorado Health Foundation's policy perspective, what emerging issues or policy developments do you see on the horizon that are likely to have the greatest impact on healthcare access and affordability across Colorado?
Yeah, thanks for that question, Joanne. And I don't want to sound like a broken record, but I think I'd like to lift up what Ross mentioned previously. I think we are at this moment in time right now in our healthcare universe where we're coming off the Medicaid unwind and looking squarely in the face of a lot of big policy changes coming at us from HR 1. Ross mentioned the implementation of Medicaid work requirements coming in January of 2027. And I think this is also compounded by changes in the state share of SNAP payments. And they're just we're getting hit from multiple angles by these really big changes that are going to have direct impacts on families and communities and providers across the state. I think we're already starting to see the indications of some of those impacts in the data, but I think we are at this moment in time where we're being called to really think strategically, not just how do we go back to the healthcare system that we had, but how do we reimagine and rebuild a durable primary care system that is going to be resilient and help us get through this challenging moment in time that takes into account those policy changes, those demographic shifts, as well as some of the economic realities that Coloradans are facing. I know at the Health Foundation, our team is thinking a lot about actually working with a futurist to think through how can we reimagine this future and what is it going to take to really strengthen clinic capacity, protect the safety net, reduce administrative burden, and support the workforce to really advance community-centered models of care that are going to help us meet this moment in time. I will say that's going to take all of us from all the different sectors to imagine this system. And 2026 is a really big year. We've got some big elections. We're going to have a lot of changes in leadership in our state. So I would just encourage all of us on this call to really think through how can we continue to educate our elected officials to work together and to create some shared visions, acknowledging that we are at a different moment in time, and it's going to take some creativity and innovation on behalf of all of us.
Alexa, could I chime in there as well?
Please.
I'm opinionated about this. I think in addition to everything that Alexis just uplifted, this is not a particularly sexy recommendation. However, if I'm a policymaker, I'd be thinking about what are the investments I can make for long-term population health improvement and long-term cost savings to the system. And the research and lived experience is really clear that prevention, integrated, affordable primary care, including behavioral health and oral health, that investments there pay off in terms of helping improve the lives and the outcomes of our communities and in controlling the total healthcare spend agnostic to payers. So that's another recommendation I'd like to make, not just solidifying and making sure the safety net in primary care is secure, but thinking about how do we make investments in that system so that we can improve the population health and control total healthcare spend.
We have a follow-up question in the chat, Ross, for you, related to your comments just now. Related to preventative investments, you mentioned oral and behavioral. What about food and nutrition, and how is that showing up in your network?
Yeah, amen. What a great addition there. Food and nutrition, certainly housing, access to the social determinants of health that drive our health in many ways much more than we can control within a community health center or clinic. So that I would definitely put food, access to affordable local food, nutrition as a key component of preventative care.
Thanks. I have one more question. Lucia, this one's for you. You offered a couple of comments related to the regional differences on healthcare. You specifically referenced kind of like the Eastern Plains and additional concerns that folks have there about just the travel time to get care. Is there anything else that stands out for you? We have, CCHN is serving folks across the state. We have several other folks on the call who are working across the state. Is there anything else that you would share that's really popping related to the regional differences and related to healthcare or other items that you've seen in Pulse?
To be honest, it's actually quite striking the extent to which there are a lot of similarities, right, in terms of the perceptions of the increase in cost, the cost overall, and the ability to get physical health care. I think that those items on the travel times was actually one of the places where we saw a key difference, as well as the Eastern Plains folks being a little bit less worried about cost in that one particular question. I will say what it jumps out to me, and as I think about that, is more about kind of the demographics of the populations in those areas. And I think coming at it from that frame, right? So there's both obviously rural areas or areas that are less served. The travel times are going to be a bigger issue for those geographies. But I think there's also trends throughout the data on the impacts, right, of uninsured people, unemployed or low income, and the experiences they're having, as well as those who, on the plus side, right, if there's a greater share of the population having access to Medicare, there's a lot of stability that comes with access to that. So I think for me, a lot of the difference have to do with those demographics. And I think I know a lot of the folks on this webinar probably already know this, but in thinking about how to serve different regions, I think thinking about the population makeup is really an essential factor.
Thanks, Lucia. Anything else that any of our speakers want to offer? I do see one final question from Elaine in the chat, just related to folks that are not registered to vote. I will just say that the sample for Pulse Poll includes folks across the board. So it's reflective of everyone who lives in Colorado, including those who are registered to vote or not. We are not taking that part into account. Well, thank you again, and thanks to everyone who joined us. I want to say thank you to Ross, Lucia, Alexis for sharing your perspectives. Thanks to all of you. This is a new format that we're hoping to replicate on a couple of other deep dive topics, shorter, like 45 to an hour briefings and conversations on specific topics so that we can get deeper and help answer some of those more specific questions. As you see in the chat, you will receive a follow-up email with a recording, resources. If you have any questions, please don't hesitate to reach out. We have several ways that you can ask questions through the Pulse Poll website. Or if you would like to have a presentation to your organization or coalition or community group that you're working with, let us know. We're happy to do that. And thanks again to the entire Pulse Poll team. We deeply appreciate your partnership and making all of this work possible. Thanks so much for joining us today. Have a great afternoon.